Thank you so much, Dr. Adis, Dr. Ree, and Dr. Carnell, for really fantastic and thought-provoking presentations. You covered an awful lot of ground in just a short amount of time. So I think there will be a lot of questions that people will have addressing a lot of the nuances that you covered. I'm going to start with kind of a two-part question that has come in for Dr. Adis, and then afterward, the other Dr. Carnell and Dr. Ree can chime in as well if you'd like. The first part of the question is, how do you distinguish healthy weight gain during adolescence, which is a natural part of puberty, from unhealthy weight gain when using a metric with low specificity like BMI? And then relatedly, is it important to differentiate unhealthy weight gain from obesity? And this person would like to know whether you could say more about how current research might allow for that differentiation. And let me know if you want me to repeat any of that.
I'm going to try and remember all of that. So for the first part of the question, how much weight gain should you be gaining during puberty? So I think that it depends on how you look at it. There's a lot of research that says by the time a child goes into puberty, they're already at 50% or around that of their adult weight. And so they're going to be gaining throughout puberty, I think, around 10 pounds a year throughout puberty. So when we're talking about unhealthy weight gain or too much weight gain during puberty, you're thinking well beyond, 10 pounds. We're talking about kids who are gaining 20, 30, 40 pounds a year, which unfortunately we've already seen in the ABCD study. We've seen some kids consistently year after year be putting on that weight even during childhood. And I think, we all think that kids are always growing, or you might say, oh, this is baby fat, but sometimes it just compounds and we don't even understand anymore because of like all of the different advice out there. What is normal and healthy weight gain? Relatedly, I think the next question was about unhealthy weight gain versus obesity. So I'm a really big believer in that we should probably not really be focusing so much on whether or not someone has obesity or they don't have obesity or they're overweight. It's about how much weight someone might be continuously gaining. Because you can have someone who has obesity and they are going to stay um, the same weight for years. And that might have a very different set of metabolic consequences than someone who continuously gains weight. And I think that's one thing that I wanted to stress in my talk is that, you can have someone who's in the healthy weight category who gains 40 pounds in a year, and that's going to have metabolic consequences. And so if we use these BMI cutoffs for these categories, you're going to miss being able to target an intervention for that child or adult even, because 40 pounds is a lot for a child or adult. Is there another part of that question that I missed?
No, that was it. Dr. Carnell, Dr. Ree, anything else to add?
I thought that was a great summary. I don't know if part of the question was about the metric of BMI, which obviously there's lots of kind of chat about that. And I think we would probably all agree on the call that that's just kind of one way of indexing, weight in relation to height, and other measures are also important. They're not always available, obviously, for primary care physicians, but obviously BMI is not the whole story. You could have a high BMI and have quite high muscle, so it's important to measure body fat, and we can do that with things like waist circumference or BIA scales. So that's important to consider those, and also the kind of metabolic consequences of obesity when we think about whether it's causing a health risk.
What is a BIA scale?
That's body fat impedance. So this is a facility that's available on a scale, and you can stand on it, and it will give you an estimate of your body fat. There are also lots of other ways of measuring it in research. We can use MRI, we can use DEXA scans, but a really good way of estimating somebody's fatness levels, especially around the waist, because central adiposity can be more metabolically harmful, is actually waist circumference. So you can do that with a just with a tape measure.
Yeah.
Thanks. Dr. Ree, anything else to add?
Yeah, I just wanted to add that I think what Dr. Adis said earlier, it really, when we think about tracking growth and weight gain during childhood and adolescence, I think it ultimately depends on what is metabolically healthy for you. And there's so much genetics that determines that, so that it's really hard to just use, a growth chart or whatnot to determine that. So it's very individualized. And so this is where I would, highly suggest that anybody listening on this call talk to their doctor, healthcare provider about what is metabolically healthy for you. And there are blood tests and things like that that can be done to figure out where you stand.
Great. And Dr. Ree, kind of a follow-up to that, what do we know about the flip side of unhealthy weight gain? So thinking about anorexia and restricting calories, that often starts in adolescence and sometimes before adolescence. Can you comment on that?
Yeah, that's such an interesting topic as well. I mean, similarly to obesity, there's also genetic priming that happens there. There are genetic factors that may put somebody at risk, and then, whether or not the environment can influence the ultimate outcome is, there needs to be more research on that. But again, the rate of weight loss also results in uh, different kinds of physiologic outcomes. So impacts on your heart, on your cognitive functioning, things like that. So again, kind of tapping into what Dr. Adis was talking about before, it really is this rate of change, whether you're gaining too much or losing too much, and how quickly you're doing that, that can really have a lot of physical impacts on your health.
Yeah, that makes sense. So the rate of change one direction or the other is really the most impactful in this conversation.
Yeah.
Um, Dr. Carnell and Dr. Adis, wondering if you can comment on changes in early nutrition and well-being that can help prevent obesity in the future. It's a big question, so maybe try to encapsulate it if you can, or highlight the things you think are most relevant.
I mean, I highlighted this in my talk, but I'd love to say it again. Because I think the strongest evidence that is coming out of research on kind of parent feeding and early nutrition is this sort of responsive feeding approach, which I mentioned. So being kind of responsive to the infant's hunger and fullness cues, that's shown some good evidence for obesity prevention. And then the thing that we know really works in terms of healthy eating habits is actually exposure. So we know that if parents kind of provide children with access to healthy foods, they may not love it, first of all, but if you kind of provide them with the opportunity to have little taste, that will kind of encourage them to eat more healthily. And then we're also learning that, as children get older, that's probably one of the most powerful things you can do. So maybe even more than kind of overtly restricting um, uh, less healthy foods. The parent's job is really to provide the healthy food environment, and then it's more of the child's job to kind of decide how much to eat. So I think that's what we're learning in terms of the parent feeding research. So the healthy home food environment is kind of where it's at.
Yeah, I would echo that restriction we know just creates a desire to want to eat more of that food. I like to think about picking one tangible small action item for each family to work on, or like what works for them. Not like trying to tackle everything. Like you're going to exercise, you're going to eat healthy. Like that just doesn't work. You're going to go to sleep early. It just does not work. But if you can pick one small thing, and there are lots of approaches. So another approach might be like to limit sugar intake. So it's not to avoid sugar intake, but instead of buying the Go-Gurt with all of the sugar that's in there, maybe just the yogurt with fruit in there might be one little substitution that you can provide as a healthier option. And so there is still some sweetness from the fruit, but it's not, a Go-Gurt, for example. And so just trying to make those little tiny substitutions. But we know also that a really big part of how much or what kids are eating, it's in school. They get, many of their meals a day in the school. So I think there is, a part where the parent and the family plays a role, but there's a huge component of school lunches and snacks in schools that they're filled with sugar, they're filled with processed food. And, we can't say get rid of school lunch. It's just impossible. Every parent would cry. But if we could just also really kind of be advocates at the school level, whether you're a parent or an educator, and just saying like, hey, let's get together and at least try and make one change on the menu that might be better so that you can know that your child is getting some good nutritious food in the school is a good place that we can all help with, not just as a scientist, but we can all be there.
That's great advice. So really bringing it to what we can all do as individuals in our communities to help be advocates for our children and our communities and neighborhoods. So thanks for that. I want to just shift gears a little bit. There's some questions that folks are asking around mental health and trauma and the associations between those and risk for obesity. So particularly a question around post-traumatic stress disorder. Dr. Ree, I think you touched on adversities, child adversities, and the greater the number of adversities, the more impactful that can be. So the question is, what is known about stress responses and then the relationship to overeating and brain development? And we'll start with you, Dr. Ree, and move on to the rest of you afterward.
Yeah, it's such a complicated process. And I think what we're learning with, the stress response in terms of post-traumatic stress and those kinds of things are a little bit separate from the mental, like people have mental health disorders and things like that. But when we think about the stress and living in stressful environments, so it could be, abusive environments or neglectful environments, but it could also be what I mentioned earlier, the adverse social determinants of health. So if you have food insecurity or you're not being able to access healthcare, all of these things are triggering an inflammatory response in the body, which then can play and sort of add on to the genetic risk that you may have or the poor food exposure that you may have. So it all becomes this additive kind of experience. And potentially, and I think this is where more research needs to be done, and I think Dr. Adis and Dr. Carnell might be doing some of this work, is really looking at how some of these inflammatory processes are not just affecting, different organs, your pancreas, your heart, and things like that, but specifically the brain, and how your brain then is processing rewards, which, can be satisfied with food, or how do we get this in other ways? So it's a complex situation. But yeah, I'm curious what Dr. Adis and Carnell think about this too, because there's a lot of overlap in some of these processes.
Yeah, I think like we all know, not everybody is an overeater when they're stressed, but we know that stress, it's a biological mechanism that our body gets primed to eat when we're stressed out. And that's because, historically we needed to energize, we have stored energy and we needed that to be able to fight or flee. And then, we just used all this energy, just had this big workout. And so your brain is like, okay, once that stressor is gone, you're going to want to eat. And the brain's going to tell you, I want to eat high, very calorically dense food. And so that's a biological mechanism that's there. And that if you have someone who has PTSD or who's highly stressed out all the time, that constant stress makes this dysregulated so that you're always you're not sure if you're hungry or full. You're always going to want to eat these foods. And so it kind of also is it's a shift, go back to the brain, because it is controlling it, but it's not, you have control, but you don't have control. And so I think, that's a whole there. I think when I think about this, there's no one size fits all for obesity. When we talk about treatment, just telling someone to eat less who is stressed out, that's just not going to work. And so, if we give them medication to decrease hunger, that probably isn't going to work for someone who has a lot of this stress. And so we have to really be thinking about, individualized approaches for different people based on their situation. And we know that stress, it doesn't just affect your food intake, it affects your body in so many different ways. You're more likely to get sick, and because your immune system becomes dysregulated. Well, all of that also goes back to the brain and can cause changes to the brain that makes it even harder for individuals to then stick to a diet or make healthy food choices. And so, when we talk about reasons for weight gain, it's rarely, oh, you just want to eat that food, or you just made a poor, stupid choice, or that was a harsh word, but like that's how we talk about this, or you couldn't afford good food. There's so many reasons for weight gain, and even in the case of stress, you can have someone who is an emotional undereater, but they mobilized all of this energy, the stored fat. Well, that has to get reabsorbed if they didn't physically spend it. And so that's going to get absorbed in the stomach, and they're going to gain weight, even though they might have not eaten anything. So I think we have to be sensitive towards these different ways or reasons why people gain weight.
Yeah, I
Dr.
would echo that individualized point that you made there, and touching on what Dr. Ree said about the kind of mental health issues. It may be that in some cases, these things kind of have to be addressed before you can even begin to make those behavioral changes. So I think that's what the power of studies like ABCD is, that because we have such a large amount of people, we may be able to pick out these different phenotypes and look at the factors that may be able to help them. So that's something I'm sure we'll all be interested in looking at in ABCD going forward.
Yeah, absolutely. Leveraging the power of ABCD for these kinds of individualized approaches is really a great opportunity. Dr. Ree, a question for you around the prevalence of social media as a risk factor for obesity and body image issues. So this is a big one
Yeah.
for youth and adolescents, and then thinking also about food marketing and those kinds of things and how our algorithms on social media are tweaked just for us. If you could
Yeah.
comment on that, and then Dr. Carnell would love to hear your take too.
Yeah, this is such a hot topic. And I think again, it's really interesting. It's not a simple, I think, in the media in general, people like to simplify and say, oh, social media is bad. And there are a lot of negative things that can be shared on social media. But the other thing I think, and I think maybe this is a theme that keeps coming up, there is this interaction between our environment, be it social media, be it food access, whatever it is, and our genetics and our biology. And so, yes, social media can have a lot of negative impacts in terms of the body image messages that are out there. And in particular, I hear a lot from patients and families who talk about, oh, social media made my child have anorexia, like the opposite of obesity. But there are a lot of people who are exposed to the same kind of social media who don't develop, obesity or anorexia. And so there is something about this interaction between, are you genetically or biologically primed, and what is your environment sort of triggering in you? And this is why it's so complicated. So I always say, you can't help what your genetics are. And, some people are luckier than others, but it's good to kind of know some of these like biologic tendencies in each of us so that we can then shape our environment to kind of set us up for the most success. Um, yeah.
Yeah,
Thanks.
I think I agree. This is such a hot topic, and it's something that we're all scrambling to get our heads around because it's evolving so quickly. The platforms change, the functions of the platforms change. For example, some people have tried to look at the distinction between kind of active use of social media versus kind of passive. That probably makes a difference. Obviously, the content that you look at makes a difference. So there are many things which are important other than just kind of the dose of how long you're looking at it. And ABCD, for example, does try and measure the more kind of addictive use of social media, which does seem to be kind of related to other mental health aspects and could be related to binge eating, which we haven't touched on too much, but which is kind of consuming large amounts of food in a short space of time and feeling kind of negative emotions connected with it. So these things do seem to cluster together, but there's still much we need to know about what is the healthiest way to use social media, and kind of all of us researchers are trying to figure this out now because it's so important.
Thank you. So a big question next for all of you, and maybe we'll start with Dr. Ree. Given the complex interaction among genetic factors, among environmental influences, and within those categories, there are so many different things, right? Are there particular developmental periods during which the home environment, for example, might have a greater capacity to modify one's obesity risk?
Yeah, I mean, broadly, I would say childhood, which I think is not a great answer, but there's so many time points, in the early infancy, toddler stage, and then the other area or the other time point I think about too is adolescence, when there's a lot of growth, puberty is happening, so many things are sort of manifesting in terms of genetics and biology at that point. So those are two time points in particular, I think, that have always had a little bit more interest and focus on, what is that interaction between genetics and biology? But there's constant growth during this period. And so without getting into too much complexity, there are potentially epigenetic changes which are also happening throughout this time period. So it's hard to pinpoint one, but if we're going to focus on a couple, that early infancy, toddlerhood, really trying to create a great environment at that point, and then adolescence, which is what we're studying.
Yeah, I think it's really important to think about how the, effective interventions or things you might do are completely different throughout childhood. So we know that responsive feeding interventions have had some success in infancy, and then parental modeling and healthy home environment is very important in kind of preschool and school years. But then as children age into adolescence, obviously they're eating more outside the home, then it might be school environments or kind of broader community environments and their peers who may be the most important social influences. So that's why it's kind of important to think of this as evolving through development.
Yeah, I would agree. And something that just kind of came to my mind is like a simple takeaway is that it seems the most critical times is just as children are starting to eat outside the home. So when do you see that? You see that, early childhood around when they go to preschool and they're going to kindergarten. So that tells you that that's a really critical window. And then adolescents, as Dr. Cannell mentioned, they're going outside the home. They're going to go to college. They're going to go eat with their friends. And so if you take those two anchor points of like, I've got to be able to set up my child to be able to handle the food environment when they're not home, that those are really two good anchor points in development to think about that.
Thanks. And Dr. Adis, I'll continue with you on one of your, I think toward the end of your presentation, you had toward the last slide, maybe you had gut bacteria as one of the potential influences of obesity risk. So somebody asks about the association between gut bacteria and obesity and what that association means and whether it's been replicated in other research samples.
So I think the gut microbiome is a really hot topic area right now, and we're starting to learn more about it. We know that what we eat actually can influence the gut microbiome. I don't know for adults if it changes it that much. So you might hear some things like, go drink your kombucha or go eat your yogurt. I don't know if we can change it that much. It's really, really important early on in life where we're setting everybody up. But what does happen as you eat unhealthy foods, that does change it. So when I'm saying like I don't know if you can necessarily promote all of the good gut bacteria that you want or make substantial changes, but you can harm it. So, eating high fat, high sugar foods, those are going to change your gut microbiome to produce what we call like harmful byproducts that actually can leak into your bloodstream, and that causes systemic inflammation. So that's one reason you hear, high fat, high sugar, or obesity is associated with an inflammatory response, or these foods are inflammatory. There is that component. So, there is a tangible piece of a small little step that you can take away from that is like, okay, maybe I shouldn't eat, these potato chips or, ice cream is a high fat, high sugar all the time. You can have it sometimes, but if you want to, not make the gut microbiome more harmful than it is, that's one tangible step. But I think that it goes across the board. So that's kind of where I also go back to like, it doesn't matter whether or not you have obesity or you don't have obesity, because you can be someone who is a healthy weight and be very thin, and you can eat a terrible diet and have a terrible, like if you want to say terrible, but like gut microbiome environment as just as someone with obesity. So I like to stress that it's about, individual differences where you are and your body that we really should be focusing on rather than, specific groups.
Yeah.
Right.
If I could, oh, sorry. I was just
No,
going to
carry
add
on.
to that when tying back to your other question, Elizabeth, about critical time points, the gut microbiome can also be really shaped early. And it's so that first like 2 to 3 years, depending on how the infant is fed and also many other factors from delivery, can really shape what your microbiome looks like at that point, which then can potentially put you on a trajectory for, metabolic issues or weight issues or things like that. So it is really interesting, this, interaction again with your genetics and then your microbiome and then what hormones are being produced and, all of that. So yeah, Susan, I don't know if you want to add to that.
Yeah, I was just going to add, yes, I mean, this is sort of, we're learning a lot more about it. Obviously, there are many other reasons why consuming sort of the highly processed foods, which are high in sugar and high in fat, might lead to obesity. And the main one would probably be the increased energy density. So there's kind of more calories in. So I think the gut microbiome is probably playing a role too, but it's also kind of a calories conversation. So I think that's just important to remember. So there may be kind of other reasons why those foods are not working for you as well.
So we've got just a few minutes left in the hour. There's so much to touch on, and I would like to just encourage attendees there'll be an email that will be put in the chat at the close of the hour where you can follow up if you have additional questions or feedback. We'd love to hear from you. But for now, I'd love to close with a question around turning it back to ABCD and the evidence that we have currently around these topics around unhealthy weight gain and developmental trajectories. If each of you could comment on like one gap in the current evidence base that you think ABCD could help fill in the coming years. And we'll start with you, Dr. Adis, if that's okay.
I think that, the longitudinal nature to see about how weight gain actually may shape brain development is going to be really important. So we've already seen that, there might be underlying differences in the brain that predispose individuals, but seeing what that weight gain may actually do to the brain later on and how that may relate to cognition is going to be really important for intervention and prevention and treatment options. And that is a really big, powerful piece of data, especially, ABCD is with youth, but that can even apply to adults because, 70% of the adult population is overweight or has obesity. And so it's really going to give us a lot of information to be able to help a whole bunch of Americans and people worldwide.
I would say I'm really excited about how ABCD can start picking apart some of the pathways. So, for example, I talked about how some individuals are at higher genetic risk for obesity, but not all of those individuals will go on to develop the brain differences that we described and to develop obesity. So we really need to know what those folks are doing differently or what in their environment is helping them. And I think that it's really important to kind of turn this and other studies like that to make them solution oriented so we can start identifying those things we can use to help people. And I think we'll be able to do that in ABCD going forward.
Yeah, I really don't have much more to add. I think what both Shauna and Susan have already mentioned is the power of what we have in ABCD. And I think understanding that biology, and we do have some of this information in ABCD, and looking out into young adulthood, because many of the youth now are they are adults or about to become adults. And this is when we start to see sort of the long-term impact of, obesity. If you've developed obesity when you were younger, what are we going to start to see when they're in their 20s? And I think this is going to be really helpful and hopefully put more impetus on this country to try to focus a little bit more on prevention, because we can start to pick apart what are the risk factors, be it social, environmental, biological, parental family structures, and really focus on the prevention efforts that we can try to implement to prevent this from happening over the course of someone's life.
Thank you. Thank you so much. And thanks to all of you. It's hard to believe our hour is up. That went pretty quickly in my mind. Great discussion. Thanks so much. And again, I think our hosts behind the scenes are going to put an email in the chat that you can all feel free. Here it is, a slide with resources to follow up if you'd like, and an email if you'd like to provide additional feedback or questions here in the lower right for you. And with that, we will say good evening to all of you, and thanks again for joining us. Bye-bye.